Hello everyone. I'm Dr. MV Chandrakanth. Uh, I'm a cancer specialist. I work in Narayana Hospital and RN Tagore Hospital, Kolkata. So good to spend some time and talk on a few topics on lung cancer. Tobacco, any form, whether a smoking tobacco or a smokeless tobacco, what we call as gutka or pan, all are equally dangerous. So, among so many causes for cancer, tobacco is one of the leading causes of cancer. So, whenever you have a puff of smoke, the smoke starts right from the oral cavity and then it goes into the throat and then it gets into the lungs, and from the lungs it enters to the blood and it reaches the kidney. So, sort of this particular smoke reaches each and every part of the body, raising the risk of cancer of each and every organ. You start from the oral cavity. Mouth cancer is common with tobacco. Nose cancer is common because you exhale it. And then throat cancer is common. Esophagus cancer is common. And similarly, lung cancer. All these cancers happen because of smoking itself. So this is called field cancerization. Wherever smoke goes, wherever I keep the pan, in all the areas, uh, cancer happens. So when it goes to the kidneys, for filtering, there also it raises the risk of kidney cancer. So almost every body is affected because of smoke. Tobacco gets into your blood and marrow, and even it raises the risk of some blood cancers too. So it's something like a slow poison. You keep puffing every day, and your lifespan goes on reducing each day. So it's as clear as that. I will tell you some red flag signs of lung cancer when you have to think probably I must get checked for cancer. So, whenever you have cough or any blood in sputum, not for one day, when it is persisting for more than 1 to 2 months and is not going away at all, when it is increasing in severity, then you must think that you are at a risk of lung cancer and you must get tested. And then, secondly, any change in voice, the hoarseness of voice, what I say, you know, again, which is persisting for more than 1.5 to 2 months, is a red flag sign. And then difficulty in swallowing, when I swallow, it easily goes, but if I have a difficulty in swallowing, that is again persisting for more than 2 months or so. So these are some danger signs of common danger signs of lung cancer, which I can say. There are other symptoms, but these are the three common signs which I can think of. So screening is a technique of finding out cancer even before I develop symptoms. Like at present, I'm speaking to you. I may have a 2 centimeter lung nodule or some mass in the lung, but I have no symptoms. So it cannot be detected unless I have symptoms. So screening is detecting a disease before it becomes symptomatic. So what to do for screening? A chest X-ray is a very crude investigation. We cannot understand the lung pathology. So the way we screen is by a CT scan, and the type of CT scan we use is a low dose CT scan, where the radiation dose is low so that it is harmless or almost safe. So whom to screen? We don't screen everyone. We target individuals in whom the lung cancer risk is high, especially those individuals who have smoked for more than 20 years or so, what we call as pack years, if they have crossed 20 pack years, or those who are current smokers, ongoing smokers. In those people, if they have crossed around 50 to 55 years of age, up till 75, 80 years in their lifespan, we do a annual CT scan. Once a year we do a CT scan of the chest. And if there is any suspicion, we will act accordingly. This is called as a screening in lung cancer, and this is really shown to pick up lung cancers early. But again, the screening is not for everybody. Like It's for high risk individuals, and it's upon shared decision and mutual discussion with the patient. There are both pros and cons. The good thing is I will be able to pick up the cancer early and I will be able to treat early. Certain problems are I may pick up non-cancerous things also, like a small heel tuberculosis, which may not be significant and all that. It may cause some anxiety and so on. So screening is good provided you use judiciously. Lung cancer is a deadly disease, and unless I become symptomatic, I do not detect. And in 80% cases, we detect lung cancer at fourth stage. And the treatment of lung cancer is extremely expensive nowadays. Immunotherapy, target therapies are expensive. Therefore, allocating funds for treatment is not the way to go because it's an expensive affair. The whole policy making should happen in prevention, that is, preventing lung cancer to happen. How do you do that? The target population for smokers who start smoking is in their teenage, around 14 to 15 years. This is the age where any person really starts tobacco or smoking. So, how we can prevent our teenagers from getting into this habit? So, remember, lung cancer, most common cause still remains smoking. Remember, any smoking or whatever things we develop, they are habits, but they are not our nature. Our nature is joy and happiness. So, if you can uh, make these younger individuals get into something called productive work like creativity, so give them alternative sources of happiness. So, education is a stressful affair in the present day. So, you need to open avenues for their creativity that is positive. And secondly, we should not be projecting smoking or tobacco as a heroic thing, in any sort of social media. So we need to discourage projecting smoking as a heroic symbol. That needs to be discouraged. And those kids or those individuals who have started smoking must be urged to quit tobacco, all forms of tobacco. Just putting a photo of cancer on uh, a cigarette pack, of course, it is helpful, but is not doing that great work. So it's more of a positive strengthening towards creativity of these young individuals and discouraging projections as a heroic affair. So these were important. Plus, those who have started smoking, you need to enroll them to quit smoking, provide incentives for them to quit smoking. So instead of allocating the funds in screening, diagnosis, treatment, you need to allocate the funds and energy for preventing these teenagers from getting into tobacco. And those who have started tobacco, you must allocate them or you must encourage them to quit. I think this is how best judiciously we can work on preventing lung cancer. Thank you.